at times. And for trainees as well as practicing clinicians, it's very important for the trainees when it comes to their long cases, when they have to describe the or elaborate on their treatment plan, dealing with relationships of their clients. It's very important. And thank you very much, Ms. Roshan Dhammapala, for agreeing to do this lecture for us. And I'll briefly introduce. I'll not go on with the whole CV, but I'll take in the most important things of the CV and introduce Ms. Roshan Dhammapala to the audience. She is a clinical psychologist with approximately 21 years of experience across a range of service settings, both hospital-based and community-based mental health services. And she also has a strong interest in skills and knowledge development within mental health and psychosocial support services. She has been involved also in the curriculum development and teaching in mental health, counseling, and psychosocial care. And she has had a vast experience in 3 countries, Sri Lanka, Zimbabwe, and Australia, in counseling and psychosocial care. And she's currently the visiting lecturer and the clinical supervisor at the Faculty of Graduate Studies, University of Colombo, and is involved in the postgraduate diploma in counseling and psychosocial support, in the Masters in Counseling and Psychosocial Support program, and in the MPhil in Clinical Psychology program. And Ms. Dhammapala had been the course coordinator of the MPhil in Clinical Psychology course conducted by the Faculty of Graduate Studies in the University of Colombo from 2016 to 2020. And from 2012 to 2017, she has been the module facilitator and the research supervisor of the Psychology of Coaching for Masters in Business Psychology program conducted by the Oxford College of Business in Colombo. And she has some experience in Australia as well. She has been a team leader and area clinical manager with programs involved in the Life Without Barriers program in Melbourne and Adelaide, Australia. And in from 2001 to 2003, she has been a lecturer and a course coordinator at the Department of Psychiatry at the University of Zimbabwe at the College of Health Sciences, and been involved in the Behavioral and Community Health Sciences program. And she has worked as a clinical psychologist in Zimbabwe Psychiatry Unit in the Peri Yatwa Hospital in Harare, Zimbabwe. And Ms. Roshan Dhammapala has obtained her BSc Honours degree in Psychology from the University of Zimbabwe in 1996. And in 1999, she has obtained her Master's in Science in Clinical Psychology, again from the University of Zimbabwe. And she is going to talk to us on a very important topic today, skills and techniques in couples therapy. Without further ado, I'll hand over to Ms. Roshan Dhammapala to present her lecture. Thank you very much again for agreeing to do this for our college. Thanks.
Thank you very much, Dr. Gihan, for that introduction. Disruption in my sound or video, just give me a small message or let me know, because I can maybe turn off the video if it's disruptive.
At the moment, it's fine. You can go on.
What I thought I will do today is a combination of skills from systemic therapies as well as the direct couple therapies, because the majority of the couples that we encounter in Sri Lanka are very much part of a larger extended family system. So what I've found is it's sometimes difficult to focus only on a couple because some of the issues that they have come from the system, and it's maybe expected in their culture that they play these multiple roles. All right. Let's start. Hope we can also have a bit of interaction and input from the participants if you have any questions. So first step would be that before we step into this work, we become aware of our own norms, our own values, our beliefs, expectations about relationships and gender roles, because we are not meant to take these in to the sessions that we conduct with our clients, because our clients also will come with their own views, their own values, and their own interpretation of these roles. So as much as you must have your own, keep an eye and be aware of them, because otherwise you won't be able to put them on pause in the middle of your sessions, particularly if you have a client who has quite a different relationship. Okay. A few live notes also before we start. Maybe more to do with the objective. What are we doing with these couples when they come to us? So it's important to know that we are actually not doing individual therapy on these two individuals that are part of a partnership. That is not the main focus. It may be a part of your overall work with a couple, which is because they have specific issues, but our effort is to try and help a couple to also see their relationship. Most often, couples can feel or sense their relationship intuitively, but very rare for them to step out and actually look at their relationship as some system or mechanism and how it functions. Because, like all of us, we're emotionally connected to something that distance is difficult. So each partner may sometimes present their needs or even present their problem of the relationship from that individual perspective. So it's important for us to keep in video. Okay, maybe I will switch off the video. No, okay. So it's important for us to keep in mind that we are the facilitator that tries to help them to see their relationship and to get a better perspective of how it works. The other thing is that couples tend to describe behavior as caused by the other person rather than viewing it as interdependent or reciprocal. As this image on the left shows, that it is what people say and do, they react, that keeps a particular cycle going. So this will fundamentals that we are playing in bringing some focus and visibility to the interactions rather than to each individual's behavior. Other thing to remember, couples, although they come and talk to us, they are, if they are in the presence of their partner, they are still communicating with each other. And sometimes they may use you as a voice or a mediator to be able to convey things that they are unable to convey on their own. So this is something to be observant about and be cautious about, because if you very comfortably step in, because you may have that authority and they are seeking that from you, if you step in to do that for them, you don't resolve the problem. You are simply diffusing that moment, but you're not equipping the couple to deal with this difficulty. So be aware what each partner conveys to you about their expectations from you. They may not say it directly, but you will pick it up from the requests that they bring to you, or the appeals. Often in Sinhala they will say, මේකට අපිට විසඳුමක් දෙන්න. So this is something to be conscious of, because this flags the difficulty in that partnership or the missing skills in that partnership. Finally, very important to remember is you can't solve the problem. You can't solve the problem for them, and I guess you aren't going to solve any of those problems for them. But as I said, you may mediate, but extend in the long run unless equip them to we'll discuss that more. So I thought I will introduce some concepts from this particular approach called integrative behavioral couples therapy. So there are multiple different types of couples therapy. There'll be psychodynamic, there'll be the humanistic, we'll have cognitive, we will have behavioral. Behavioral in particular
Hello,
this
what
particular
happened?
way.
We could not hear you.
Oh,
Okay, I think it's all right now. Yeah,
my connection dropped.
yeah.
Okay.
Now it's fine.
Okay.
Can't hear you again.
Sorry. Okay. I'm just trying to connect to data. It might be more reliable at this time. Let's continue. Okay. So this particular approach, integrative behavioral therapy, couples therapy, is trying to shift away from trying to effect change, instead to try and move couples towards acceptance. So I'm not necessarily saying this is the recommended approach for all types of problems, but there may be some situations in which couples go to war with each other because of personality traits in their partner. Instead, they say happy. That's not really something that is easy to change. A person who is by nature not very forthcoming with their emotions, a person who is emotional by nature, these may be fairly hardwired types of traits. However, um, although these may have been the reasons or the points of connection at the beginning because they were opposite, as the relationship continues, they begin to irritate the other person. So I'm offering this approach and a couple of um, techniques in this because it may be useful in these sort of situations. And it's specifically looking at tolerance-based strategies. So you have to choose when these will be relevant. So one step in this IBC is empathic joining around the problem. This may actually be quite useful across many problems that couples present, because you almost always you have two angry people who are warring with each other over the problem. So very polarized views. Therefore, it's very difficult for this couple to solve the problem because neither is connecting with the other to accurately understand what this issue is about. They are mostly holding on to their view of things or their feelings. So in empathic joining, the therapist tries to encourage the couple to try and share the more vulnerable feelings that they have as a result of this conflict. Often what is expressed are what we may bolder, harder feelings, anger, offense, sort of a position from which the softer emotions like hurt, fear, vulnerability are generally masked. So it's more, it's safer sometimes for couples to be angry at each other than to say, I'm hurt by what you said. So in this empathic joining, the therapist is trying to create some safety for partners to be able to share the underlying emotions in relation to a conflict. And so if this happens, it generally diffuses the war or the polarization, and it might allow partners to hear that their partner is vulnerable and might prompt them to reach in towards them rather than to hold up them against their hard or angry feelings. Let's get an example here. So the therapist is saying, how do you feel when your husband is late? The wife says, well, I feel angry. And now the therapist probes a softer or a hidden or a less or a more vulnerable emotion. What else do you feel? And the wife says, I feel resentment. It's still a hard and it's a powerful emotion. It still doesn't show a vulnerable position. And which now the therapist asks a leading question, and which has to be done with a lot of caution, or it can still be a neutral question. But they say, I wonder if you also feel abandoned. And then the wife says, not really, but it does make me feel I'm unimportant to him. This is a simple example of how, when couples share emotions, that we listen for hard and soft. Hard means the bolder, stronger, more formidable positions from which couples can speak about what's difficult, but they often don't present the more vulnerable emotions, mostly because it's not safe. So therapists listen for that and seek opportunities for this information to become visible in the couple, to the couple themselves. The second item I'd like to talk about here is encouraging unified detachment. So remember, the objective here with the IBCT is tolerance based. It's the things that may not necessarily be easy for a partner to change. So therefore, if I can't change this person that I am or this trait that I have, then I have to try and fix it for the way they are. This doesn't apply to all situations, but not certainly not for some situation where it would be abuse or violence. But maybe these are traits that anger and regularly trigger arguments. So in unified detachment, we are trying to help the partners to view this disturbing behavior as something that both people contribute to. So you're basically beginning to see it more as a reaction than a personality trait. Somebody's withdrawal, for example, or somebody's attempt to express or seek out emotions and how other people feel. We begin to see these more as a reaction, a result of their interactions rather than fixed personality traits. So what we're also trying to do here is that we're trying to reduce the polarization that comes from going to war with this person about this particular trait. So in unified detachment, you find that people can allow this trait to exist without necessarily considering it as a flaw in that individual, but something that commonly exists in the population. So it could be, often there is a clash about emotionality. One person is generally not very talkative or expressive about emotions, and the other partner is. And this can become quite unfulfilling for both, or an irritation for one of them. So going back to try and explore the origins at which, when the partners met, they would have at some point appreciated this trait because of its difference. Because of its difference to them. So trying to trace back what was the beneficial or the appreciative value of this difference is one of the approaches you can try and take to reduce polarization. The other is to try and de-escalate the kind of conflicts or the intensity of the conflict that takes place around these differences. So if we are moving from the first one is empathic joining. Empathic means that you begin to understand the other person's feelings about that situation, not just your own, and you begin to shift away from the difference to one of we are different, yes, but we will not go to war about it, which is what's meant by detachment. Unified is that we accept this difference. It exists in this person, but it's not something evil, something mad, something bad. It's just something different to me. So how can I still connect with this person and accept that they have this difference rather than trying to erase it or to change that person to be more like you? So these are two particular, I feel, two useful strategies to try and discuss with partners and elicit certain emotions, particularly when those problems are things that they can't change in their partner. And like I said again, it's not when those behaviors are destructive or of danger to either of them. This third, this third concept, which is part of IBCT, is to become aware of the way partners attribute problems. How do they explain the other person's behavior? And so, one suggestion is that this fundamental attribution error is used maybe by all of us, but also in couples to explain my behavior versus my partner's behavior. So when my partner tends to do something that upsets me, I tend to that behavior to something that's personal. It's due to his personality traits or එයාගේ හැටි. But if it is to do with me, I generally tend to diffuse it to be something that's more situational. This is something that was forced on me. මට මෙහෙම කරන්න සිද්ධ වුණා. I was made to be in this situation because of the circumstances. But don't tend to offer that same option to the partner when we are describing a situation. So this is one of the things that also contributes to this polarization. He did this, he intended to, he is bad, she is selfish. Therefore, and then polarization and animosity begins. Rather than to look for the balance in attribution. Could it have been something related to the person or some part of the situation also impacting on this person in behavior? So two key themes we are taking, two key concepts we are taking from IBCT, empathic joining and unified detachment. And we'll see how we can use this later as well. I'll go into this next approach. This next approach is to see couples within systems. So we are aware of family systems therapies and theories. This is when we're working with families. Instead of using an individual approach, we tend to see the family as a whole system. In the same way, we are going to look at a dyad or a two-person unit and how that two-person unit functions within and is impacted by a family system. So here, this is a small we engage with couples, we are observing multiple things. And we have to consciously shift our focus not just to the individual's information back and forth between that partner and counselor or therapist, but also between the couple and the relationship. So each person is communicating with each other, and they are also, each person is communicating with the therapist. So there are multiple points of observation here. When one person is talking to the therapist, is the other person listening? What is their body language? How much do they absorb of that message? And when they respond, how have they heard that message? So these are some of the patterns that we are listening for, and it is certainly part of our assessment. Okay. I have this very complex picture here, but really it's not complex. It's a picture of a family, and each person is considered your smallest unit. And then round some of these units are other circles, which are called subsystems. You may be familiar with this if you have learnt about systems theories. Now, this picture is useful for us to keep in mind when we are doing our assessment and formulating the problem. What is actually going on here? Because the couple will come to you, or sometimes it's one person who is about the system or the family, and they are describing how they see it. They are sharing a perspective from their position. However, we may not necessarily be able to extract information about um, who does what, how they do it, and how they impact on each system unless we ask certain questions about those interactions themselves. The interactions themselves. So when you're exploring this relationship, try to ask for examples of how they go about doing things. They may start by sharing problems, and we should try and move also away from that to look at how they deal with everyday transactions. How do how does the couple make decisions? How do they allocate responsibilities? Who does what? Who has demands from outside this system on them? Um, the other key thing is boundaries. So boundaries are indicated by these dotted lines. And by boundary, what we mean is how flexible is it and accessible is it to get to each of these people. So some people have strong and rigid boundaries, meaning information doesn't flow between that unit in and out. They may be quite strict in their views, or they may be restricted in their thinking. So they are not flexible in the way they are. Certain things have to be done in a particular way. If we have really flexible and diffuse boundaries, you might find that information does not get contained into the unit that it should be contained in. For example, the parent subsystem or the couple subsystem needs to contain some information within it because it only belongs there. There is more power there. There are more decisions that have to be made. However, if one of these partners does not feel connected to their husband or wife, they may rely on somebody else in this family system, maybe daughter, son, maybe parent, a sibling. And so you'll find that where there are rigid or diffuse boundaries, there is always a spillover into some other area to compensate. So we also want to look at boundaries, and we also want to look at where does conflict originate in these systems. Are they between certain people? Is it across all of them? Is it from outside of this unit? These are the things that we want to map out. So maybe I can pause for a minute to give participants a chance to interact. What are some of the questions you can ask to elicit some visibility, not just for us? Remember, the purpose of what we are doing is to get couples also to be able to see their relationship. So, what kind of questions might you ask to help them to make this system more visible to them? Any suggestions? So there are some cues on the left-hand side also. These are other influences of the couple and the family. How do we identify conflict points? Questions ask. I mean, you can type your questions if you don't want to interact. Okay, no one wants to ask the questions. But I'm assuming that these are some of the common conversations that we will have with couples. And often couples may present some of this directly to us. The danger is that we only take the information they offer and we don't do a full scoping of the system, particularly in being able to shift perspective rather than only seeing it from the narrator's perspective. Okay. I have one question. Okay. When there is a financial problem, who do they try to who tries to work it out? Is it? How do they try to work it out? Yes, good question. Good question. How would they work out a particular problem? So it's sometimes useful to phrase a neutral question and see how this couple responds, because they may be quite focused on a problem that they want you to solve. But it may not elicit or highlight some of the relationship difficulties or skills that this partnership is missing. Okay, let's go on to the next slide. Okay. So here are a few more things to observe. In these interactions, while we get couples to talk, we want to become aware of the following things. We may not ask questions, these are mainly part of our observation. So one of it is how aware is each partner of their own feelings, their own needs, own intentions, and behavior. This becomes apparent when uh, the partner talks about a situation, particularly from the other person's fault based view. මෙයා මෙහෙම තමයි මේ හැමදාම මේ වෙලාවට මෙහෙම ඇවිල්ලා මෙහෙම කියනවා. This person is like this, at this time they say these things and they do these things in these situations. At that time, it's also important to observe how aware is this person who is conveying this message to their partner, the tone, the emotion, the hidden message that is going across with the words. We may not ask, we just observe this. These are part of your assessment. The second is each partner's ability to clearly express opinions, ideas, feelings, needs. And this is probably one of our biggest areas of focus, because there are certain things that each partner will struggle to express. Probably because the other person does not enable safety in expressing these issues. However, they may have either found a way of not expressing it or acting it out in ways that the partner doesn't understand. So be observant of how they communicate ideas and opinions. And we will, in a few slides later, we will look at checking with the partner about how much they understood what their partner is trying to convey to them. Third skill we want to observe is perceptive skills. This is about intuition, insight, or the ability to see beyond their view. See beyond their view, my view of things, my opinion of this person, versus a slightly more detached aerial view of the how are these two people functioning. And sometimes you can ask a partner or a couple, and each partner to offer this is, if you were to describe your relationship of these two people, Saman and Nimali, they are not people you know, but if you were to describe them, how would you describe them to me? So you're offering them this position of third person to engage that view and try and find a way to describe it. And surprisingly, some couples, some people are able to step out of it, to describe it. And that's very useful for both of them to be able to do it. Finally, another key trigger is the competencies related to emotions. And we may be dealing with this as an individual problem as well, but you will also be able to observe it in the way they interact. So each partner's capacity or their effort. Sometimes we are not good at it, but that's okay. It's how much effort do they put in to be aware of their own and the partner. Two things, their own feelings and their partner's feelings, and the ability to express and regulate the feelings. So these are key skills in maintaining a healthy interaction and a good relationship. Four areas that we are observing simply by watching these couples interact. Okay. The next thing I want to introduce is how diodes work within systems towards this concept called homeostasis. And you would have been familiar with this thing of concept of balancing. I think it was Minuchin's theory in structural family systems about looking at systems as structure. They all move towards achieving some balance because it enables the system to function better. So in this particular picture, I've taken some screenshots out of a video, but you can see this link on the side, which maybe if I share the slides, you can watch the video, which is quite helpful. In this video, there is a family, or there are three generations depicted in this family, and our couple is the center, is the middle level generation. The generation above is the husband's parents. And then there is a loss or a death in one of these systems. So in this case, the father of the husband passes away. So in this bigger system, there is a vacuum created, and his mother now becomes more dependent on her son. What do you think will happen here in terms of recreating balance? What do you think would happen here for a system to re-establish balance? Anyone want to contribute? What do you think will happen here? Vacuum in the system, and the systems generally move towards balance. What do you know that happens when couples complain about their in-laws? Any suggestions?
The mother might want more attention from the son, and that will upset the balance that they have within the family.
Yes, so that is happening. We can see the mother has now become, that system is not balanced, and she has dipped in to this second generation to become more reliant on them. Okay. So this is the danger of balancing, because the son is more likely to now be pulled in to fulfill some of the responsibilities that his father provided for his mother and the family. So by stepping in to try and balance that subsystem, he is likely to create an imbalance in his own level with his own wife. So as you can see now, with this shift or division of his time and responsibilities or resources, there is an imbalance in the second level. And then what happens here? The wife becomes more reliant or more connected with children, who are the children or the siblings subsystem. What could be the problems that arise as a result? What might the mother do? The wife, sorry. What would the wife do? How might the wife describe problems? And how might she be coping with the husband giving more time outside of the family and the marriage? Could it impact the children's system? What do you think?
The mother might become more attached to the children and vice versa. The children might be more attached to the mother, and parents might become detached.
Okay, yes. Do you think that the same thing can happen in the third level, where someone in the third level steps up to fill one of the parents' roles? For example, often it is an older sibling that the parent begins to rely on who gets promoted to take on some responsibilities that the father is now unable to assist the mother with. So this is just an idea of what may be impacting this dyad, this center, the middle level couple, when there is some change in the equilibrium in their bigger system. And these are inevitable. These are life events. The good relationships or the strong relationships generally have good skills that we listed here, these ones. And they are able to express and negotiate their needs in a manner that might get these imbalances resolved in a more productive way. But the people who may come to you are people who are able to express these needs. So think about what those barriers would be. Could it be, and we're generally looking at the middle level. What are the barriers between these partners to be able to convey their needs, listen to each other's requests, and accommodate them? So keep this in mind when we work with the couple. You can't only deal with one set of issues. You may also be dealing with a child who has become a bit more powerful. You may be dealing with a mother-in-law who has become very demanding and intrusive. No, I'm not saying that you will bring them all into therapy, but you may have to consider how boundaries are re-established. And each couple, each partner in the couple may need support with that. Okay, let's go into some of the techniques. So we'll cover a few things because we may not have a lot of time to discuss these things, but these are generally starting from trying to get some information from the couple. Good starting point would be to get each partner to narrate their story. By story, it means each of these people has come, or at least one person has come with a particular agenda or issue in mind. But it might help to rewind to get a narrative of their relationship. How does each partner describe their relationship? And if this is done together, this is really helpful. The key to remember is you are not part of this unit. So you gathering all this information for yourself is not as beneficial as this information becoming accessible to the unit, to the pair. They both get to see, oh, so and so thinks it's like this. Well, I used to think it was like this. Realize this difference does exist. In doing so, we are not trying to drive a difference or a ridge or division between the pair. We are simply trying to make visible that two people are different and will have two different points of view, but can coexist. So occasionally partners may argue because They may feel, oh, so and so can't remember. He or she doesn't keep time for us anymore. It's always about the children. It's always about work. It's always about the loan. There is no more time for us. We had time when we were, maybe in the first few years of our marriage. This may be one person's view of it, whereas the other person's view might be, we acquired a lot of responsibilities along the way, and I felt that my partner was not very supportive or interested in shouldering responsibilities. They wanted to have fun, and I felt I was carrying all the responsibility. So it's by getting both parties to share their view or their roadmap in a way, each person gets to hear how their partner experiences them, simply because of their differences. And to reiterate, we are not trying to eliminate the differences. We are simply trying to help people to move from a polarized view of the differences to a more reconciled acceptance that so and so prefers to be like this, is better at doing these things. I prefer to be like this, and I'm better at doing these things. And in general, I am not good at these things. So and so is not good at these things. So this view is what we are trying to map out. Second skill is now what the therapist is doing. This is a skill called reframing. It's trying to represent the problem in a more constructive way. And it's very, very important. This is often where couples get stuck because the problem is framed in a way that of fault focused towards a particular person, and therefore they disengage. And as a result, the couple can't then resolve or work through the problem because the way it's presented in itself creates the barrier. So one of our interventions here is helping to reframe that makes the problem more accessible, approachable, and more understandable. So here is an example. My husband is unaware of what my children and I need. Everything is done for him, including his own duties at home, says the wife. The husband says, they only come to me when they need me to pay for something. So here is the polarized view. Right? So angry couples in general might have this polarized, problem-focused way of presenting their issue. They may not see that each one contributes in some way to shaping the other person's position. So let's see whether we can try to this problem is presented so that we help this couple to engage the problem. Can we try? So we are trying to move away from a fault-based view to either a need or an emotion that is trying to be expressed. So we can offer it as a hypothesis. And it might come across as, so what you're saying is, and you might proceed to say this. Does anyone want to try reframing what the wife has said to begin with? Any idea? Any suggestions? What do you think her need is? What is she asking for?
Husband to more involved in the household chores and with children.
Okay, yes. And is he hearing that need? Is he hearing that request based on the way it's presented? Based on his reply, we can assume he didn't hear that request. So can we try to reframe it if we were talking to the wife? It would be even better if we encouraged her to try and do so, but we can help her. Any suggestions? One more effort? Okay. Here is an example of reframe. So the therapist addresses the husband and his statement, which is, they only come to me when they need me to pay for something. The therapist says, so you feel that you are only valued for your ability to contribute financially, but you miss not being valued as a husband and father? Is that right? So here is it's a bit of a leading question, but it's also bringing him back to the circular nature of this relationship. It's not a division where the wife does certain things and the husband does certain things. He has other roles in which he's in some way not being active and therefore not being recognized. And so that is highlighted through this reframing. So you are being valued only for one thing, but the query is put to him. But do you miss being valued as these other roles? And in another way, what is also being presented to him is an opening or an opportunity to take them up if he wants to. Husband replies rather impartially, oh, I guess so. At which point the wife reacts again. I think that is how he wants to be. And so she's angry. So she's not convinced of his answer, and so she reacts again. Okay. What could you ask at this point? If this was happening in front of you, what would you ask at this point? Who would you address? Can we try and address the wife? We're trying to now address an issue or a need that she is presenting. What can we say here? Any guesses? Any suggestions?
Shall we hear his view?
Okay, yes. So you would ask that. Yes, that would be good. So you are in a way you're sending a message to the wife also, and you're giving the husband a chance to comment. Can I encourage you to challenge you a little bit? In this case, if we step out of being the mediator and help these two people to interact better, what could you say to the wife? Because there's something she's also not hearing. So if we say, shall we hear what he has to say, then I'm also part of this relationship now. What if I step out? What if I give it entirely back to her?
Madam, we can ask what's the way that you would like to be his husband act?
What would you like? Who are you addressing? The wife?
Wife.
Wife.
Ask him, wife, what would be, your need and way the husband would be?
How do you want your husband to be? Yes. What do you want? Basically, you are saying to say what is the need you want from your husband.
Yes.
Yes. Good. And so that's a useful question to put, because now you're encouraging this to communicate a need clearly to the husband, because the way she has communicated it at the beginning it's not clear, and he is getting defensive. Okay, let's see. Now, so wife's role. Here's another suggestion. Could we ask the wife, because she is saying everything is done for him. That means in some way the role of husband and father is being relieved of those roles in some way. She may be, without even being aware of it or not being happy about it, she may be still maintaining this position of him only being the financial provider. How can we say this to her without being accusatory, but to be more encouraging? Is there an opportunity that we can offer the wife?
Maybe we can ask the wife, why do you think your husband might be behaving like this?
Yes, we can. She might, given the circumstances, personalize it and blame him and say, here, this last time, I think that's the way he wants it. He doesn't care about us. So we
Madam,
have to focus that question a little bit more. Yes, please go ahead.
We can ask the wife, we can tell the wife in what areas or what aspects she wants her husband to contribute to.
Yes.
What
Yes,
have we
good.
what have been done up to now to make the things change, madam? We can ask on the
Okay,
wife.
yes, good, very good. So we can find out what they have already tried to make these changes. Yes. Could we challenge her?
Would you like to give him?
Queen? Sorry, go ahead. Go ahead.
Sorry, ma'am.
Go ahead.
Would
Go
you
ahead.
like to give him a chance to change?
Yeah, that is okay, except the thing is she has been trying to change him all this time based on her methods. So she might think she's already done that. The issue here is the way she has communicated the request is not clear. And the way she may be acting may be preventing him from coming back to those roles. So there may be some rearrangement that is also required. So could we also give the role to both of them? Otherwise, this is focused entirely on the husband being a bad person who needs to be fixed, rather than the dyadic relationship. This is something two people are creating. And we try not to perceive one person as bad, unless, of course, there is some abuse going on. So in this case, could we say, is there anything you might be doing to enable him to stay this way? Are you making things easy for him? So much so that the role of husband, the role of father is already done for him. So there is nowhere really for him to come back to. So how can you make some room? Right? So now you're addressing not just the husband, but you're addressing the partnership. What could we say to the husband? Could we try to re-engage his interest in the spouse and family's needs? How can we encourage that? So we are not instructing him. We want to explore whether that's something he wants to do.
We can ask him what areas he'd like to actively engage in or share more responsibilities with regard to children and maybe household responsibilities.
Wonderful. So you open up the opportunity and see what he is willing and interested in picking up. Yes. So what would you like? Would you like to reclaim some of these roles? And what would those activities be? Good. Okay, so notice here we moved away from trying to fix one person. We looked at how two people may be creating and maintaining certain behavioral patterns. Okay. Right. This is another key skill that we need when we are dealing with systems, either it's a couple or a family. Circular questions are a way of trying to elicit information and emotions that are not often expressed, or they are hidden from our view, and more so, they are hidden from other members of that unit. So, as it says here, in a relationship, it's not just one partner affecting the other. It's how both of them work in a, or react and interact in a pattern that becomes their dance. So, and we will have a look at this, what this dance looks like. But it's talking here about couple interactions being circular rather than A affects B. Therefore, C, it's usually A affects B and B affects A. A does something to B, B does something to A. And so this circular effect keeps going round in repetition until we illuminate this pattern to them. We illuminate this pattern. So one of the purpose of using circular questions is to explore the difference in relationships. The difference. That is not to drive a wedge. And sometimes I think therapists feel fearful of highlighting difference because then they'll think, oh, now they're going to fight over this difference. And that is a problem. The reality is those differences exist, but the partners may not accept these differences. They may act as though that person is my partner. They should think, they should feel. එහෙම තමයි හිතන්නේ. They should think, they should feel, they should be in this particular way. The reality is that partner is an independent individual person. So this circular pattern is trying to illuminate some of the hidden emotions patterns that take place. Here is the example. The green circle is the first person, be a husband or wife. This is what goes on in them. They have some idea, some need, some feeling, or some thought. And then based on that thought, a bit like the CBT pattern, they have a feeling about that thought and they express it through their behavior. It may be something they say, it might be something they do. These three units are all part of their communication. However, as we know, we have played this game secrets, passing the secrets, by the time it gets to stage of the third circle here, the way the behavior is presented may not represent what this idea or this need was. So when it's passed on here, the second person, the partner receives this behavior and tries to interpret this behavior. What does this behavior mean? Why has this person just turned and ignored me and walked away? So then based on this message, they form their own interpretation. They are angry because I said this to their mother. That's the thought. So they have now interpreted this behavior. It's not anything to do with this thought. It's not clear. They have a feeling, she is going to behave like this. Fine, let her be like that. And then their own reaction to that behavior. And so this keeps going in circles because now this partner receives this behavior as the response to what they communicated. And it keeps going. So I hope you understand this circle. Each partner has their own set of thinking, their feelings, but the way in which it's communicated through their words or their actions may not accurately represent what they're thinking or feeling. So this is why we often say communication is the biggest issue. But here are the smaller components of it. And for whatever reasons, life experiences, or previous upbringing, the way we express and present these thoughts and feelings is then going to cause some error in partner understanding what is being said. And they then respond to this error message and share an error behavior. So let's look at an example here. So there is Priya and Daya. Priya is suggesting to Dayan, maybe it's a good time for us to build our own home and move out of your parents' home. Dan is putting this idea off because he's waiting for some money to be repaid back to him. He has given some loans to his friends. Priya sees his procrastinating. Now notice there is a suggestion, there is a need expressed, and Diane's behavior is the message back. He puts it off. He puts off the meeting that need. Now Priya is interpreting that behavior and giving that behavior a meaning. He is putting it off. This means he lacks commitment. He doesn't care about me. Based on this interpretation, now comes the emotion. I'm furious, I'm angry, and then the behavioral output. She makes an accusation, says irresponsible, or makes some points some flaw to his behavior. At which point, now you see the partner is having their reaction to the communication. He shuts her out, disengages, he's very angry. So you can see how partners' interactions are the circularity or the cyclic nature in the way partners communicate, particularly when there is an error in their communication. So what we want to do, what is the role of the therapist? The therapist's role is to try and make these messages clearer, to in some way help the partners to recognize and match their expression to what they're actually trying to say. Here and there has to represent what they feel or what they are thinking. This is a very big task. It's a very big task, and it's not just an individual piece of work. Sometimes the partner does not offer the safety required to be able to express these needs. So here is a breakdown. If we are trying to use circular questions, we are trying to bring visibility to the partner's thoughts, feelings, particularly, not so much their behavior. We are trying to help them to improve that output. So keep this in mind again. This is a little different from working with like a mental health issue, because there the interaction is between your patient and you. And you are the person who's taking that data in to analyze it. But in this couple's work, you are trying to elicit this information for the partner to hear it and for the partner to respond. And we don't try to fit ourselves in the middle of that. Because sometimes I may be perfectly understanding what the husband or the wife is saying, but their partner can't understand any of it. So then all this analysis is of no use. So keep in mind when we are using this cycle and when we look at this picture, this is part of our assessment. This is how this one communicates, and then this is the way this one responds. Once we've mapped it out, we use circular questions to make these feelings more visible to each other. We make these feelings more visible to each other. Okay. So let's see whether we can understand through this example here. So it's the same person here, but we'll look at the examples of the circular questions. So wife is complaining, this is Priya. Wife is talking to the therapist and saying he always gives his time first to his parents, then to his business, and to anyone who wants his help. He has loaned money to some of them. They have not paid it back. He has no limits with others. The limit is only applied to me. That's the wife's picture. Then the counselor is now asking, what kind of limits are placed on you? I don't even know that he has agreed to loan so much money to people. But when I ask him about money in relation to our plans to build a house, then he says we don't have money. We have to wait. So at this point now, therapist is asking, how did you feel when he said you have to wait? Okay, now I'm going to go back in my slides to this. Keep this picture in mind, because because this nature, maybe even actually this one, this is better. We are trying to spotlight key parts of this cycle in the therapy session, but we are trying to do it in a safe place. Because in the moment that couples are triggered, they may express their emotions in an unhealthy or in a destructive way. So in the therapy sessions, we may be able to create enough safety to try and help these partners to express what they were trying to say. So here is an example. How did you feel when he said you have to wait? This is a circular question. Why? Because it highlights an interaction between two people and a person's response to a third person, usually with family, but here to the partner. We are making the situation visible to somebody who doesn't see that interaction. The wife is saying, I felt really sad and let down. He never told me he gave those loans to his friends. It's like I am the least important person in his life. My feelings are never considered. Okay. So now she is expressing an emotion that may not have come out when they had their argument, because it would have come out as being angry. Do we remember in the integrated behavior therapy, they were talking about helping partners to reveal softer emotions rather than the harder ones. The harder ones are the anger, the defiance, the offense. How dare you? How do you? That kind of feeling. Whereas the softer ones are the ones that make us feel we have less power. We are vulnerable. Sad feeling, let down feeling, maybe feeling alone, maybe feeling abandoned. These feelings are much harder for couples to express, especially when they don't feel safe. So in the therapy session, try to create safety for couples and partners to share these feelings that often might shift their polarization. And here the counselor is asking, how did you convey to him how you felt? Okay, my question to you all is, what's the use of that question? For whom is that question useful? How did you convey to him how you felt? What is the use of that question? Any suggestions?
To give the wife some insight about the lack of communication skills.
Okay, yes, but something a bit more specific.
We want to see
About
whether whether she has expressed the same thing she felt or a different thing.
Exactly, exactly. And you want her to be able to do that evaluation. Did you express exactly those soft, vulnerable feelings or something else? So then the wife says, I lost my temper. I shouted at him. I told him he no longer cared about our marriage. And how could we ever hope to raise children together like this? Right? So now she has said, this is how I really felt, but this is what I told him. Now, this is really helpful in a therapy session because for that person, there is an opportunity for insight. Then the therapist goes to husband and says, and what did you hear or understand about what your wife wants from you? Now, this is another circular question. It's going back to that diagram, that circularity of communication. And it's spotlighting this particular point here. How did they receive a behavioral message? What did you understand? What was that behavior about? So now what is the use of that question and for whom? This one. What they're asking the husband, what did you hear and understand about what your wife wants from you? Who is that question useful for?
To wife, when she will get an understanding and she will be able to see the disparity between what she meant and what she has really expressed.
Right, right. Really good. And it may also be useful to the husband to realize that what she is trying to say is not what she actually said. See, it's certainly beneficial to the wife in terms of changing her communication or realizing she needs to, but it's also used to husband or reduce the polarization, because now he realizes, okay, that's not what she meant to say. Husband then says, she treats me like I owe her money. I felt like that is all she wants from me. I work very hard and this is money I have earned. And I know what it's like not to have money. And these friends I helped are so great to me. Now, what comes out of that? What is useful about this? What he just said. Who is it useful for? And what does it offer some, how can it change perspective here? What the husband just said. This is all she wants from me. I work very hard for money. Then this part. I know what it's like not to have money. And these people who I'm helping are very grateful. What has come out of this statement?
He's been not valued, madam. He feels that he is not being valued without money.
Yes, he is thinking this is the only thing she needs from me. He is also communicating a value of his own, which is not necessarily understood or seen by the wife. What is that? It's a valuable one. What it's like not to have money and what it's like when people are grateful when I help them. So this is an important revelation about the husband's value system. We have at some stage he did not have money, he worked hard to earn this money, and it's oriented towards helping others who are struggling. So you will need to know as a therapist, there is now some clash here between his focus on helping others who are struggling, so a more altruistic view, and for the wife who then feels it doesn't include her because she is obviously seen by him as someone who is sufficiently provided for. So these are observations you might make and offer later in feedback. So let's see what the counselor is saying. The response is, how did you convey what you felt to the wife? Same thing. And he says, I told her I didn't like her attitude towards money, and another conversation. So this is a summary or a snapshot of how we can use these secret points in time rather than to get caught up in who is spending money and those values and what the husband should do, what the wife should do. None of our business. So we have to come out of all of that. We want to highlight the way they are talking to each other and why they are not connecting. Right? So remember the first few slides I said we can't solve their problem, but we can help them to understand why the method they are using is effective. Any questions with the circular questions? How they are used? Okay. So this is,
Sorry, I need to ask a
go
question.
Ahead. Yes, please.
After the circular questioning, do we give them a feedback? What I notice out of your way of answering and the way of questioning. So this is what I saw. Are we giving that to them?
Yes, certainly. We are giving that feedback. I will talk about it in the next few slides, but very important to share our observations. I have this diagram here, which might help you in a formulation, or it might be a simple exercise that you give a couple to help them to map out this circular behavior that each has. So, for example, after something like this, you could get them to try and fill this in. So this is basically that circular thoughts, feelings, and behavior that each one is having. But then at the point of behavior, we want them to be able to identify how they are communicating it to the partner through their actions, through their words, any sort of things that they can become aware of. So it may be a useful tool for us, but also something that we share with the partner. This visibility of this pattern is helpful to partners because they then recognize that person's behavior is not a standalone flaw that they should address. මේක තමයි ගැටලුව. මෙයාගේ මෙහෙමයි. Then it becomes an individual issue, which is probably more useful in an individual therapy. But in a couples or systems approach, we want each one interacts and creates and contributes to these reactions. Any questions about this? I think this format is fairly clear and it links with our previous slides. Okay, thank you for the previous question about feedback. This is my last point. We certainly can't make any changes by only using active listening and empathy and being kind to couples or our clients. We must be able to gather evidence through our assessments and our formulations to offer meaning back to them about the way the problem is being presented, how the problem exists, and how they are dealing with the problem. We have to be very conscious that we are sensitive, objective, and constructive. Three very, very important components. And that's why I put that slide right at the beginning about being aware of your own values, your own views of relationship, because sometimes those things can influence the way we speak. Yes, somebody has a question. Would a value clarification exercise as a couple family be useful? Would it not create a direction to work towards therapy, motivation to go forward? Yes, certainly. Value clarification exercise is useful if that is the clash, like in the case of Priya and Diane, where there was a misperception of one person's behavior being uncaring and neglecting of the other partner. Very useful to then have that discussion. And then we are moving not necessarily to change it, but as we remember in the beginning, we talked about shifting towards acceptance. The creating this detached place from which we can allow this other person to have a behavior that maybe is different from ours. And we don't necessarily personalize it as an attack on us. So thank you for that suggestion. Feedback. Okay, so let's see what is feedback. Feedback cannot be our personal opinions, right? So very useful in those the maps that we used at the beginning to keep some notes of what we are observing. So here's an example of a feedback, and it's useful sometimes to just get permission before you share it, because then you give that person a few minutes to catch their breath. They know some message or information is coming their way. Otherwise, they might hear it more as an attack or an accusation. So you might say, Priya, can I share an observation I made? I noticed that when Diane is talking, you did not look in his direction. And you didn't give an indication that you heard what he was saying. So I wonder what were you trying to communicate at that time? So here we are not giving her advice about bad behavior. We are noticing a way she behaved, and we are accepting that that is a form of communication, and we are encouraging her to find a clearer way of communicating it. So these are simple snapshots that might happen in the session itself. Another example, Diane, then from what I understand, when your wife sends you a text during the day and you don't answer, she is concluding that you don't think she's important enough to be acknowledged. She says you have other things that are more important to you than her. That's the feedback. Dan is saying, but I do care about her. And then your feedback is, but the behavior is not conveying that to her. In fact, behavior, which is maybe you don't respond at the time, is conveying the opposite message. I wonder if you're aware of this. Now notice this again. We are not telling him how to behave. We are simply drawing attention to the fact that, are you aware you are sending this message? And is that the message you want to send? That is as far as we can engage, we can intervene. Another example is, you both said a lot of things to each other, but I did not see either of you showing any interest in listening to your spouse. So you both said things which made your partner have to first defend instead of leaning inward to listen and to understand you. So I wonder if you both can think about what you can do to make it safer for your partner to listen to you. It sounds like it's something you both want. So now in this feedback, we have to be really careful not to be critical. So it has to be delivered with as much kindness or compassion, but accuracy. Because if you even observed an example, it's really useful to cite examples. මහත්තයා මෙහෙම කියනකොට මම දැක්කා මේ මිස් මෙහෙම කෙරුවා කියලා. ඒ වෙලාවේ මොකක්ද දැනුනේ? What was going on? So if you cite the example, it will remind them what they were feeling or thinking. Right? So try and give a feedback, but without your opinion, without instruction on good behavior. මෙහෙම හදන්න බැරිද? ඔයා මෙහෙම කෙරුවොත්, those are a little bit dangerous unless that person cannot come up with some suggestions of their own. Okay, so I think I've come to the end of my my talk. If there are any questions or clarifications, I can take some time.
We have talked about the thoughts, feelings, and behaviors, and I was thinking whether if there are kind of a core belief in that relationship, like if the husband is thinking that the wife is not matching or it's not understanding, like whatever thing we say that you should change the behavior that she doesn't understand, so will it work? I was thinking.
The core belief, yes, okay. But we may have to let them come to that conclusion after some objective exploration. If it is emotional reasoning that they're using, then we need to focus on the tools they're using for their own evaluation. If I think that the risk is you may feel the burden of having to save the relationship. It's best not to get into that role. You have to step back and equip the partners to explore how they are looking at the problem. So if you explore core belief and there is some very fixed view that they are not willing to budge from, it's not likely that we are going to budge it unless, there is a mental illness there. But then we can use, again, remember this position of what was it? Acceptance, tolerance, and the unified detachment. So what I understand is that most relationships that are viable are using this. If you talk to couples who have been together for a long time, they will tell you what is the problem with their partner. Some complaint will be there. So that is there, but it's no longer something they go to war on. So that is something to think about, is if they have an irreconcilable difference, what is an approach they would like to take with it? Is it a deal breaker where the relationship cannot proceed without this? Or is it something they can permit that existence or that difference? There's another question here. Somebody wanted to ask something? Here it's asking if feedback is given, should it be in front of the spouse? I think you have to make a judgment at the time what it is about. If we can learn to give constructive feedback in a helpful way to both people, I think that's good, because it's a partnership. But of course, culture is a key thing, and sometimes we can't upset those balances. Like maybe in some relationships, the man's dignity or his pride cannot be hurt in front of the wife. Then it's up to you to figure which kind of couple it is and have that conversation with him privately. Similarly, if there are very sensitive issues, it's better that we offer that feedback in an individual session. How to use therapy to its best if you identify jealousy, abuse? Yeah, okay. That's a really good question. I didn't go into that area today because I think that's an area on its own, particularly where there is infidelity or some kind of breach in trust. But I have added in the resources, and I'm happy to share these slides. There are some videos that are quite helpful to, let me just show them to you. These resources here. Some of these videos are actually very realistic, and the example of the therapist that's demonstrating the skills is very real and very good. So I think it is the second video reference is about infidelity and a breach in trust. So maybe you can have a look at that. I didn't choose to address it here today because it's a more complex issue. Any other comments or questions? I didn't. I know that morbid jealousy and this issue is like quite prevalent in some of the couples' conflicts. I didn't address it because I feel there is a psychiatric component there. And so then it sort of a lot of these approaches don't work when one person is not well. So then the focus has to be on addressing whatever their mental health issue is, or before we can use some of these techniques. But yes, there is, I think there are a couple of different forms of this pattern of mistrust. Sometimes it's an obsessional pattern, sometimes it's a delusional pattern, and we have to try and differentiate what those are. Whether they will have insight, I think, will also depend on how the treatment goes. Any other questions or comments?
Yeah, I think, thank you very much, Ms. Roshan Dhammapala. I think, shall we wind up for the day?
Sure.
Yeah, and yeah, thank you very much, Dr. Sumudu Godavita, the Assistant Secretary of our college, for arranging this lecture and liaising with Ms. Roshan Dhammapala, and Dr. Sumudu Godavita will formally thank you to end this session. Thank you very much.
So on behalf of the Sri Lanka College of Psychiatrists, we should thank Ms. Roshan Dhammapala for taking time to enlighten us on this very important topic. That was an excellent presentation. I think all the trainees and the practicing psychiatrists got a broader view on some of the skills required by the therapists to effectively conduct couples therapy, especially the communication skills, importance of empathizing, offering feedback and reflections to the clients, along with some intervention techniques. Thank you very much again for taking your precious time and teaching us on this very important topic.
Thank you, Dr. Sumudhu and Dr. Gihan, and all of you for your participation, and have a good evening. Thank you for the attention.
Thank you very much. Thank you.